Welcome to InFocus, a program providing an in-depth look at the issues affecting all of us. I'm Mark McDonald. We hope to bring you not just a view of what's happening, but also of the people who are impacted and those working to make changes. In this episode, we're exploring COVID-19. The global pandemic has had a huge effect from healthcare to education, public policy, and the arts. We'll start with public policy. Illinois Governor J.B. Pritzker and Public Health Director Ngozi Ezike have spent the last 6 months urging the state's residents to take COVID-19 seriously and implementing rules and guidelines aimed at slowing the spread of the virus. Jennifer Fuller sat down with the governor for this report.
Governor Pritzker, welcome to InFocus. I appreciate you taking the time.
Thanks, Jennifer. Great to be here.
We'll get started kind of with a look back, as we're 6 months now since the pandemic arrived in Illinois, give or take a few days. The state's positivity rate, which was high initially, has now reached a steady level, and it's lower than many of our neighbors. How do you think Illinois has fared overall in the first 6 months, and what's coming in the months to come?
Well, first of all, we have the lowest positivity rate of any of our neighboring states, and I'm very proud of that, and I hope all Illinoisans are. It's really the people pulling together and doing the right thing that's led to that. But, you know, very early on, this had a very steep incline to it. All the numbers, particularly what I was worried about in the earliest days, were the number of hospitalizations, and then the number of people who were then going into the ICU, and then the number of people from ICU that were going into a ventilator. And then, of course, we started to see deaths. So, you know, very early, we knew that we needed to move as quickly as possible. I remember my first press conference that was entirely on this topic was actually February 28th. And then I think March 8th is the date that I put the disaster declaration in. And really at that point, there had only been a few people infected. I think many people just were caught surprised. Of course, they may have seen something on CNN about China, but to declare a disaster for the state of Illinois at that early. But that's what I was being advised by doctors, epidemiologists, scientists, and I really have followed their advice all the way along here. March 19th, if I may just take you all the way back there, was a day when I received from the University of Illinois, particularly from some scientists there, the modeling projections of what would happen if we didn't put a stay-at-home order in place. Now, remember, at that point, we had closed schools. We already had closed schools. We already had closed bars and restaurants. We limited gatherings and so on, but we had not put a stay-at-home order in. But they presented me with the numbers, and it showed that if we didn't put a stay-at-home order in, that in the city of Chicago alone, by August 1st, we would have had more than 10,000 deaths just in the city of Chicago. That's not to mention the other 80% of the population of the state of Illinois. So, you know, I looked at that and said, you know, how fast can we do this? So Illinois was the second state in the United States to implement a stay-at-home order. Nearly every state followed us after that.
All of this has, of course, had an economic impact as well. And I know that there are some needs that the state has from the federal government. You've talked about a 5 to 10% cut to this year's state budget if some help from the federal government doesn't come through. How are you working through those financial challenges?
Well, I have to say this is probably the biggest financial challenge that we've seen in this state for possibly since the Great Depression. You know, this state, when I came into office, the previous governor had, you know, refused to sign a budget. We had no budget for 2 years. Many of the agencies of state government had been really hollowed out. And when I arrived in office, there really wasn't a situation where, well, gee, there are a lot of cuts to be made in state government. We found efficiencies, hundreds of millions of dollars of efficiencies, and we put those in place. But billions of dollars, that would have been extreme in an environment in which we already had lost so much from the previous administration. So, we've been trying to sort of build back state government, and then COVID hit. And so the problem that we now face is that with a huge hole that got created by COVID in our revenues for the state, income taxes, sales taxes, and so on, it left really just for 2020, the fiscal year. So from March, when COVID started hitting, to June, that's only 3 months or a little over 3 months. That was $1 billion plus, almost $1.5 billion of a hole that we needed to fill. And then for the coming year, the year that we're in now, about $5 billion of a hole is expected in our revenues. And that's just normal revenues that would come to the state, under most circumstances, but not in the world of COVID. So this is a huge problem in a little over $40 billion budget, to try to find $5 billion of cuts, or 5 plus the $1.5 billion from the last fiscal year, which we had to borrow from the federal government. So $6.5 billion out of a $40 billion budget. That's extreme. That would mean massive cuts to public safety, to education, to healthcare, to childcare, and so on. That's just not something that families across Illinois can sustain.
Illinois Governor J.B. Pritzker, thanks for taking the time on InFocus.
Thanks, Jennifer.
In the months since the COVID-19 pandemic arrived in the U.S., a top priority has been to find an effective treatment for the disease. Southern Illinois Healthcare is participating in a nationwide effort to study the use of convalescent plasma, which the FDA recently authorized for emergency use. Steph Whiteside has more.
Today I'm pleased to make a truly historic announcement in our battle against the China virus that will save countless lives.
While President Trump called convalescent plasma a breakthrough, other experts point out there's a long way to go in finding a cure for COVID.
We were part of the Mayo Clinic trial, but as of August 28th, that trial will be ending. But we will still be using convalescent plasma as treatment, along with all of our other treatments, the ones that I mentioned with antibiotics, steroids, and we also are using remdesivir, one of the newer treatments, and we have a lot of data supporting remdesivir treatment.
Dr. Sonal Shah says they've had mixed results.
Patients who have required significant more amounts of oxygen on the ventilator itself, like the two that I treated, did not do well with the convalescent plasma, and I think it's because they were towards the end of their disease progress. Patients who we've been able to start early on, not requiring as much oxygen, on 4 to 6 liters, or before we place them on non-invasive treatments like BiPAP, have done better.
Shah says while plasma is a new avenue for treating COVID, it's not a new idea. Doctors have a lot of experience using it with other illnesses.
Well, plasma, it's been around forever. We've used it to treat the Spanish flu, the first SARS epidemic. We've used it before. What it is, it's antibodies. Like I said, it's our body's immune system responding and helping us to fight infection, and it's a byproduct, a blood byproduct, and it's just like giving a blood transfusion to someone. It's the yellow part of the blood. Plasma itself contains antibodies of which our immune system responds to fight the infection. And with more patients being able to donate these antibodies, the more we'll be able to give to patients who need them.
Even with mixed results, Shah says there's more to learn and a need for more plasma from recovered COVID patients.
We'll be able to get more people to donate plasma, have the availability of the plasma for patients so that we can have a better understanding of when and how we can treat the patients.
If you have recovered from COVID and want to donate plasma, visit the Red Cross website at redcrossblood.org.
I'm Mark McDonald in Springfield at the WSIU School of Medicine, one of the major health organizations. As you probably guessed, health organizations have had a whale of a year. One of the responsibilities here, of course, is training doctors of the future. And how would you like to be a doctor of the future and find out that your 4th year is going to be interrupted by COVID and it's going to affect everything you're going to do this year? And Rukmini Roy, you were in that situation.
Yes.
Do you remember the day you found out, it was probably in February or March, that everything was going to change?
It was mid-March, I remember. We were taking our senior CCX exams, which is when we see about 12 patients, I believe 12 to 14 patients, diagnose them. So we're hyped up on all this clinical knowledge. We're very excited to get back to the wards after we complete the exam. And we were sent an email that, for the next 2 weeks, we would not be able to return to campus. So it was difficult. It was hard to kind of wrap my head around that. And then 2 weeks became 4 weeks, and 4 weeks became 3 months.
Oh my goodness. So it was finally 3 or 4 months, because it was July, wasn't it, before you
Definitely.
could get back into the rotation that you were in?
Yes.
What specialty have you chosen?
I've chosen internal medicine, so I'm really excited to kind of touch on primary care, which is what SIU, loves to share with us, the principles and values that come with serving our community with primary care. So yeah, internal medicine was riveting for me. I loved it. So I had already decided what I wanted to do.
Yeah. But you weren't able to do it the way a normal fourth-year med student was. You spent a lot of time in front of the computer.
Yes.
Was that valuable time?
Some of it was valuable. I think the professors and the faculty that chose to be more WebEx and more virtual and were at least face-to-face with us, it was more exciting. But honestly, I wish I was really in the hospitals and the clinics. I think I was, doing cardiology and nephrology was like something big I wanted to do with my elective time, and I didn't get that. So I can't say it's probably as valuable as it was supposed to be.
Yeah. Morgan Watts, fortunately for you, you had decided on your area of expertise before the COVID hit, and you like emergency medicine, so you'd already made that decision. Trouble is, in February, when this thing unfolds and everything changes, you can't get back in the ER, right?
Right.
That must have been kind of painful.
Yeah, especially since I was so excited about my clerkship and just wanted to get more exposure. It kind of wasn't the greatest having to wait from like March until a couple weeks ago when I just got back in. So
So you're back in the emergency room now?
yes, last Monday was orientation, and I started my sub-internship in the emergency room over at Memorial.
Yeah. Did you feel like, I got a lot of catching up to do, or how did it feel getting back in there?
At first, it was a little rough just because it had been so long. Like the end of February is the last time I saw a real patient. So my first day, it kind of felt like I was kind of getting my feet wet again, but I jumped back in fairly quickly. So I think I'm back into the swing of things now.
You have some pretty good training facilities here.
Yes.
We're in the trauma bay, and people might be wondering, well, why are they standing next to this guy? Well, this is one of the, I wouldn't call him a dummy, but he's one of your patients, right?
Yes. Yeah, so we have mannequins at the MCLI that allow us to like practice techniques, run different like codes. You can simulate like a delivery. You can do other things like just learn how to intubate a patient. Yesterday I was here doing some work and I intubated this guy. So you have like equipment and everything works in here. So it's really cool being able to kind of just like work on your skills and just refine them in here before you have to go be back out into like the real world with real patients.
Yeah. Well, Morgan, thank you for visiting with us, and I wish for you and your fellow students that you'd had a different kind of fourth year, but I have a feeling it's all going to work out for you and for those who are with you.
Thank you so much.
Thank you very much. From the Trauma Bay, InFocus in Springfield, I'm Mark McDonald. Welcome back to InFocus. We've been learning more about how COVID-19 has affected areas of our lives, particularly when it comes to policy and medicine. But things are dramatically different this year for our learners too, as schools are changing how students and teachers interact. Benji Jeffords brings us this example of how education is changing, and others are helping to fill the gaps.
COVID-19 brought a lot of changes to the way kids receive their education. The Illinois State Board of Education released guidelines in July for returning to in-person instruction. Schools are required to have 3 plans for the fall: an in-person plan, an all-remote plan, and a hybrid of both. In July, the Carbondale Elementary School District decided to start the fall semester in full remote learning and purchased a Chromebook for every student. Thomas Elementary School Principal Robbie Clark Stokes says once they were notified they were going to start the semester with full remote learning, they started assigning devices to the students.
We were just taking a plan that we had already put together earlier in the summer, and putting it into fruition. So for us, we worked with our technology department here in the district and started numbering Chromebooks, getting them assigned to students that had registered, and then started working with teachers on how we were going to get those out to students in this drive-through method.
Over 3 nights, the district handed out hundreds of devices in a drive-through style meet and greet with their teachers.
Oh, I got some goodies here for you.
The cafeteria was used as a distribution center where teachers packaged together the students' laptop, workbooks, last year's yearbooks, along with other learning materials.
Luna in Ms. Nicolic's class. Smith, Chamberlain. Carnes, Mrs. Witch's room.
Teachers like Jamie Huppert missed getting to say goodbye to her students last year, but was happy she was able to meet her students in person during the drive-thru.
So we have greatly missed our students. We're excited to actually be able to see a few of them right now.
Mrs. Huppert teaches 3rd grade and knows starting this year off is quite a bit unlike any she's had in over 20 years.
This is a very different process. For teaching for so many years, it feels like becoming a first-year teacher all over again.
For the last 6 years, Chastity Felton has co-taught with Mrs. Huppert and knows this year will have its own challenges.
It's going to be very different. We're not going to be able to have those candid conversations with them one-on-one and be able to kind of get to know them the way we normally would in a normal setting. So it's going to be very different, but we're up for the challenge and we're excited about just seeing their faces.
Carbondale Elementary School District 95 and the Boys and Girls Club of Southern Illinois formed a partnership to support student members during this unique start of the school year. Executive Director Tina Carpenter says to help meet the needs of the students, the clubs made some modifications to their hours and environment to host remote learning.
We're using half of our gym, and we have 4 pods in the gym. So we used pipe and drape that we've purchased for some of our fundraising events, and we thought, oh, we can use that to create almost like classrooms in the gym.
The pods are separated into grade levels to give the kids a more school-like feeling.
So trying to keep those groups small, again, to help mitigate any potential spread.
Carpenter says the club spent some time working on how to accommodate dozens of students at the Springer Street facility.
Our safety plan is pretty detailed and extensive so that we can, again, always maintain the health and safety of the kids, the staff, and their families, because they go home to their families.
Principal Clark Stokes says each class will meet for live instruction daily and view pre-recorded video lessons and assignments on the laptop in the afternoon.
For the most part, teachers are going to be meeting from about 8:15 to 12:15 live with their students. There'll be breaks included in there, of course. And in the afternoon, kids will be able to log on and look at pre-recorded lessons from special subject teachers like PE, music, art, things like that.
Some students, like 8th grader William Tolliver, does not mind remote learning.
Remote learning, it's like way better because you get to see your teacher on the computers, and if you need help, you don't if your teacher is talking, you could just message them. You don't have to interrupt them or anything.
After the live remote session, students work on the rest of their daily lessons, and Tolliver says this part can sometimes be difficult.
The hardest part is when we all have to get offline and just do it by ourselves.
To help Tolliver and the rest of the students, the club has multiple staff on hand to help them out.
I think they're happy to be out of the house and somewhere, able to at least see their peers, talk with their peers, and their staff to mentor and help them along the way, which I think is an amazing partnership to really help continue to build community.
District leaders understand this is a new norm and hopes everyone will be understanding while adjusting to this new type of school.
I hope that parents and teachers and community members are just real patient as we learn this process for the first time. Nobody's ever done this before.
I'll see you tomorrow. Have a good one.
Some of the people most affected by the COVID pandemic have been those involved in the arts. Normally at this time of year, the Springfield Ballet Company is already rehearsing for the highlight of their season, the Nutcracker. In our arts segment, Julie Staley shows us how these dancers are still in the studio, but rehearsing for something completely different.
I'm Julie Staley. The Springfield Ballet Company has been around since the 1970s, and they've brought a rich tradition to the Springfield arts community. Because of COVID restrictions, those traditions are changing. I'm here with Julie Ratz, who is the artistic director for the Springfield Ballet Company. Thank you for joining me today.
Thank you for having me.
You guys are staying so busy amid all of the COVID uncertainties, and you have quite a history on how you got here. Let's talk a little bit about that first.
Well, the ballet company was founded in 1975, and they did their first Nutcracker that year, and I was in that production as a soldier. So I've been with the ballet company my whole life, and I've moved up in the ranks. But we're really excited to kind of do what we can in these trying times. You can see some of our youngest dancers are down here rehearsing right now. They're all wearing masks. They all get their temperatures taken when they come in. They all have to be healthy in order to come and sign waivers, and their parents have to make sure that it's okay with them. If anybody's sick, they don't come. They stay as distant as they can. We have these dots on the floor that are spaced more than 6 feet apart. We're so lucky. We have this huge room.
Yeah, we're socially distancing right now, so we don't have our masks on, but once we step away from here, everybody, of course, in the building here at the Hoagland Center for the Arts has to have a mask on, and these dancers have to have them on the whole time. They're really training intensely. So as you've obviously been in their position, and you still dance and teach, tell me the difficulty that has to bring.
Well, they're remarkably adaptable. Dancers as a whole don't have a history of complaining. They're sort of used to being uncomfortable, and they never complain. It's difficult to teach because you have to project your voice, because this room is huge. So to project your voice in order for them to hear, your mask ends up getting sucked back into your mouth. So that's difficult, and I need to take breaks sometimes just to kind of take the mask off and cool off. But these kids are remarkable. It doesn't faze them.
I'm here now with Gina DeCroix Russell, and she is the ballet mistress with SBC. You are in charge of the development of these girls, and this COVID situation has really changed the way you do everything.
Yeah, so heading into the season, we were obviously delayed a little with auditions we typically have in May, and so we kind of had to hold off on some of that. And then also, once we were able to safely hold auditions, we separated them to 2 days. It was Julie's suggestion that we could have them pre-register, sign up. Basically, we're trying to do everything we can to keep them safe and distanced. And then even as they're coming back into classes, we have that understanding that the dancers have been out of classes and they've been out of that consistent impact on their bodies, and so kind of treating them gently in that way, in an encouraging way, to help them regain their strength and their flexibility and some of that stamina that they lost during a little bit of time off.
It's really important for their mental health to continue to dance, because I always say that dance class is kind of therapeutic for people. It's a time when all the other problems of the world go away, and you have to just focus on yourself and your art form and trying your best. And so I think it's really important for their mental health to have this physical exercise.
Exactly. Yeah, mind, body, soul. So, and I think this hits all of it.
Yeah.
So,
and we divided them into smaller groups, so there are only 15 at a time. This year we're trying to focus on African American artists. With everything that's going on in the world, we thought this would be a great year to really, get some choreography done that celebrates African American artists. So that's where our focus is going, and hopefully we'll be able to perform these pieces that we're working on someday, somewhere.
We had Jacob Frazier come last weekend to work with the company, and he came in a couple weeks before that and taught the training program as well. And he is a dancer with Giordano Dance Chicago. So to have someone who's not too far, jump on the train, kind of in his own little safe distance way, come down, spend the weekend with us to work with the kids, is great. And then of course, anytime we can have our alumni who have continued with their training and education in dance, we love to have them come back and teach. So yeah, so Anna's back in the background.
Anna Benoit here today. She's been a familiar face here in Springfield Theater and Ballet.
Right, she just finished her degree in musical theater from U of I in Champaign, and so we're kind of lucky to get to have her.
It's part of a dancer's soul, When it's in your body, you have to do it. So that's why they're all here, and that's why I'm here, because we have to. We can't live without it.
it'll be a while before we have maybe some really huge audience, gathering and closed capacities. But dance, we've always been very innovative. So finding a different source of performance spaces, different opportunities. Obviously, we've used technology. When we first started coming back into company classes, we would Zoom. Julie and I would come in the studio alone and Zoom with the kids at home. So just trying to consistently adapt, and then allow them to focus on their training and their strength, and finding new goals and new little highlights to work towards.
Just have to be flexible.
Yeah,
physically
right, just like a dancer.
and logistically.
Yeah, for sure.
All right, good lessons to learn. All right, thank you so much, Gina. We appreciate your time. And for InFocus, I'm Julie Staley.
The Springfield Ballet Company will not perform the Nutcracker this year, but their passion to share the love of dance does continue. They will present Through Clara's Eyes. It's a behind-the-scenes look at the magic of SBC's Nutcracker that you can watch with your family at home. Ticket information will be announced soon. Thank you for watching this edition of InFocus. I'm Mark McDonald.
Thanks for watching this episode of InFocus. For more information on our stories and subjects, you can go to the following agencies and organizations: the State of Illinois' coronavirus website, Southern Illinois Healthcare, Southern Illinois University School of Medicine, the Centers for Disease Control and Prevention, the Illinois State Board of Education, the Boys and Girls Clubs of Central and Southern Illinois, and the Springfield Ballet. If you'd like to reach out to us, head to our website, WSIU.org.